7 Cities Built
by JT.
Any general surgeon has got to learn trauma.
Well, so far we're having all kinds of adventures.
You know, you can never have too much blood.
Let's go to CT. CT ready for us?
It's the attention to the details that make the difference between a good outcome and a tragedy.
We're going to take good care of you, okay? I promise you.
And look at this blood pressure. All right.
Number 2, double 2, second one in this accident.
Portland, Oregon, home of the great outdoors. Within an hour of the city, you can ski Mount Hood or surf the Oregon coast. The recreation is serious. Limits are pushed.
The sun comes out, people go out there, go crazy.
But some people have too much fun.
Broken bones, broken heads.
Are they drunk? Are they not drunk?
And when too much fun turns dangerous, there's one place to go. Portland's legacy Emmanuel Hospital.
He's intubated. You guys getting a pulse?
We're going to put you to sleep. It'll make it easier for you.
Where risk takers and rule breakers get a second chance.
Portland's very lucky to have Emmanuel here.
So who pays? I'm Everett Lamb, and I'm here at Emmanuel doing trauma for 6 weeks. As a third year, I'm the most senior resident, so I get to do all the operations and pretty much lead the other residents around. So that one's a transfer. This is this one. They want me to kind of take charge sometimes, and it's scary. Will I know enough to do it? It's an anxious excitement type of feeling.
We'll figure it out. I know.
No questions, lifelike 1. We'll see you in room 17. This is Emmanuel Claire.
Abdominal chest, rib fractures, attempting an IV, fell down a cliff. Where did you find that? Over a cliff. This one's coming in by life flight and they're about 5 minutes out.
In a remote ravine on Mount St. Helens, a snowmobiler rode off a 20-foot cliff. He was stranded in the snow for hours before being rescued.
Everett, stick around and get this supervised. This full arrest goes to the OR.
The fall left 42-year-old George Hunt with possible broken bones and internal injuries.
This is snowmobile.
You want to stay with that?
Snowmobile.
Okay, this is George.
Hi, George. Hi. You're at Emmanuel Hospital.
He went off the embankment, and he came down on the snowmobile and into the handlebars and broke the windshield. Chest and belly are very tender. We tried twice to get alive.
George, do you have any health problems still today?
No. Heart rate's 110.
Take any medicine? So sore in the back? Okay, we'll put this back on.
Can you wiggle your toes? Move your ankles up and down. Does that hurt? What hurts there? Looks like he has a nappy scar, tender belly. Oh!
I can't take a deep breath.
Oh, where's the x-ray? X-ray! Getting neck, chest, pelvis, and then go to CAT scan belly.
How long did it take him to find you?
A couple of guys went for help, and my brother stayed with me and tried to keep me warm. It was so cold.
We're going to bring you to a CT scanner.
Okay.
We'll check your belly, because you got pretty tender belly. We want to make sure you don't have anything injured in there.
Okay.
Sounds like you hit pretty hard.
Oh,
it was hard. He's a pretty big guy. It took a lot of force in order to bend those bars. Right there, we know there is a high chance that he has an abdominal injury. Okay, we're going to move you over.
what's hurt, bud?
My stomach.
Okay, we're going to take a picture right now.
Dr. Lamb is also worried about a spinal injury.
Oh! He's got right here?
Yes. Does that hurt your belly when he does that or your back?
Both.
Okay.
Oh! What do you need? Choosing now? Okay. Ready, set, down. That's a fuzziness there.
That looks like some probably some mesenteric stuff, and I've seen it recently. That's enough for me.
George's spine is intact, but the CT scan shows that he's bleeding inside his belly.
That can lead to dead intestines pretty quickly.
He needs immediate surgery. Time to put Dr. Lamb's skills to the test.
Did I hear you say that you're from New York?
Yeah, what about it?
Well, that's my point exactly. I used to live in New England. I can adjust myself.
No, New England's not New York.
I know that, but
We go to New England. We go to New England to calm down, all right?
My name is Jay Baruch, emergency physician.
Where's the ICU?
Dr. Baruch is deciding whether he wants to make a career in Portland. It's his third day at Emmanuel.
How do I get there? What district? The exit? Just elevator right out there? You want to know where the charts are, where to pick them up, and then you want to know where the rooms are. Brother Craig, where are you? No, where is this?
He's back here in China.
No problem. Where is he?
He's in 12B.
Where's 12B?
Down that way and to the left.
Because he was walking away, and he was right back here, and he was pointing down at an angle. He thought there wasn't a BB in it, and he put it to my back and pulled the trigger, and there was a BB in it, and it went in my back.
How long ago was this?
Saturday.
Dr. Baruch. You know, my uncle shot my father with a BB. We hear the story still. It's like 30 years later. You know, this is just...
No, it's right there.
Right there, huh? Mm-hmm. Okay. So what we have to do, I'm going to numb that up. I'm going to take the BB out.
Okay.
You're very lucky, I have to tell you.
You don't know if you should be mad at the kid or be thankful that your kid's alive and not
I
paralyzed.
would be grateful.
Yeah, we are.
I always err on the side of grateful.
Well, 3 years ago, his cousin in Minnesota shot him in the foot.
You guys got a tough family. Now you're going to feel a stick, okay? Then you're going to feel burning. You can count.
1,
You can count.
2.
You can count. That's great. You're doing awesome. Okay, that's the drape.
Okay.
How you doing, bud? Okay?
Good.
Good. Can't be really that deep. I feel like it's right underneath. It's definitely this way. It was right here. But I got the track. I thought I felt it right here. Sally? I just want to get an x-ray on it. I can't find the track. I mean, I felt the track. I thought it was right there, but it's not. All it was swelling. All right, now here we go.
Are we doing the whole 9 yards, Dr. Yadna?
Snowmobiler George Hunt is bleeding internally. Dr. Lamb has to find the injury and repair it.
I always think to myself, now there are not that many people that get to do this, and I get to do this. I get to help try to save this patient. That's one of the most incredible feelings in the world.
The handlebars of the snowmobile may have damaged organs as well as tissue.
The adrenaline's rushing, and you don't know what you're going to find. It's kind of like Jack in the Box type thing. You just go through the steps that attendings have shown you before and what you read in the books, and you make sure that nothing's missed.
What are you doing that for? What's the best way to do it?
You lift up this.
Right, find the transverse colon.
And go to the base of it.
We take the transverse colon, find it. It's right there, right? You lift it up, then you put your hand right on the spine and pull up. You can see an area of damage, see that? So it's split completely through.
A piece of intestine is torn and needs to be removed.
You want to clamp the other side? You want to just hold it? Okay.
Come through the hole. You gotta be careful when you're doing that because you go through a little vessel there.
The attending surgeons make sure that I don't make mistakes. It's good for the patients. It's good for my learning that I'm not doing something incorrectly.
Here's your segment of bowel.
Yeah, and then bring everything together. You won't miss it.
Closing time. feel better tomorrow.
Where the hell is that baby?
One BB.
I see BB. It's a little deeper than I thought it was going to be.
If you get the BB out, can I keep it?
If I get the BB out, you can keep it.
Okay.
Okay. This is the last try, buddy. Okay. There it is. Am I hurting you, buddy?
No.
Good. You let me know if I am. Else will do. Okay. I can feel it. I just can't get to it. Tracks there. I just can't. I can feel them way at the end. I just can't get at it.
Dr. Baruch calls in surgeon Martin Bain for help.
That's a big BB.
It's a big baby. And I can feel it.
Yeah.
I just can't get it.
It's easy enough to get out. It's just a matter of making a big enough hole so that you can kind of see what you're doing here. I got it.
Your dog.
Gross BB.
I met the BB and I lost.
Motor vehicle crash, lower extremity pain with fractures.
Car crash?
Motorcycle versus the utility pole.
Road rash. Abdominal pain.
At 40 miles an hour, a motorcyclist crashed head-on into a telephone pole.
This TLC program is sponsored in part by the Steel Alliance, another strong argument for the new steel. Feel the strength.
The principle behind karma is that a lifetime spent in good and useful purpose will be rewarded by coming back in a higher form. This was a very good washing machine. Another strong argument for the new steel. Feel the strength.
To build the new LeSabre, we didn't just look to research numbers or test scores. We also took a good look at your family. Introducing the all-new 2000 LeSabre, re-engineered with more safety features than any other car in its class. The new 2000 LeSabre by Buick.
This is my daddy. He's a Gemini man. He fixes cars. He can fix anything. People like my dad. He says it's because they trust him.
Gemini Automotive Care, only where you see this sign.
Please, take it down. Oh, that's a reliable door. So? I've busted through doors all my life. It's the nicest I've seen.
Look, magnetic weather stripping. Seals like a refrigerator.
That's a forever white frame. It won't yellow.
And a 25-year guarantee.
Other doors only give you 10.
Pretty, too.
Sir?
Go, go, go!
Reliable entry doors. Available at Lowe's and online.
Decode gruesome evidence on TLC. Watch FBI profilers sizing up serial killers. Experts reconstructing massacres. The clues mount on FBI Profiles, Science Times. Wednesday starting at 9 on TLC.
Was the Shroud of Turin the burial cloth of the Messiah, or a centuries-old hoax? And has...
Tonight, ex-Army medic Dr. Andy Michaels is on duty.
If you're in the Army Special Forces as a medic, and you really groove on it, there's not a whole lot of other places for you to go. You're going to be a trauma surgeon, you're going to be a mercenary, you're going to be a terrorist. You're really not suited for anything else.
Lots of questions. Answer them as well as you possibly can.
34-year-old Lauren Thayer smashed his Harley into a utility pole.
My name is Andy Michaels. We're going to be doing a lot of stuff. Just bear with us for a few minutes. Can you take a deep breath for me, sir?
Great.
Chest is clear. Stable, tender. Abdomen's distended. TMs are clear. No allergies.
are you?
Move my leg.
Left lower's externally rotated, shortened, probable femur fracture. Take his collar down. Hold your head still, sir.
Can you feel me touching you right there?
Left foot hard.
Come off of there.
Yes, sir. You got a broken leg there, sir.
Guys, grab my left leg.
I mean, I don't need films or anything. It's just reducible.
Lauren's thigh bone is badly broken and needs to be realigned.
You got to pull on your leg, and it's going to make it feel better.
It's going to hurt like crazy until we get it reduced, sir, and then it's going to feel better. When you break the femur, the thigh bone, those muscles just shorten and spasm, and they pull the bone up and over itself, and they actually give it a little twist, which is why his leg was like that. You keep the traction, please.
With his leg in traction, Lauren's bone is set in place, but he is still in great pain.
Let's go. He's got a blood gas, chest, pelvis. We'll do his belly. We'll get his C-spine films later. If you can't dissociate from the screams and the blood and the horror of the whole thing, you can't possibly begin to be functional. I'd like to get him to belly CT fairly quickly. If he does something funny with his pressure, I need to know about it right away. But yeah, he's got this tremendous injury mechanism. I mean, really bad things have happened to him, and we've all seen lots of people in exactly this situation just turn south very quickly.
Snowmobiler George Hunt is recovering in the ICU. His family is with him.
Well, I'm Dr. Lamb, one of the surgery residents here. He doesn't have a head injury. His head's okay. And his liver looked fine. His other intestines fine. He's pretty just beat up, rolled around, but he should be fine after recovering from this.
And that typically takes about how long?
Probably, if everything goes well, maybe a week in the hospital.
Oh, wow.
Yeah. Okay. Any questions? Okay.
Thank you.
You're welcome. Every save is a good save. Everybody that walks out of here alive is a good save, I think.
He tried to turn, he tried to overcorrect, and he couldn't, and the motorcycle impacted the pole.
Where's that hurt?
Back.
Motorcyclist Lauren Thayer's blood pressure is stable.
Look at that thing. Owie.
Ooh, owie.
But the CT scan shows more shattered bones.
He's got a transverse process fracture there. And the insides look okay. He broke his back, too, in a couple of places. I don't know any more about what happened, and we don't have his blood alcohol back. But we're taking bets closest to without going over. What'd you guess, Sean?
I'm going to say 220.
Katie?
257.
What do you think?
301.
So there seems to be a consensus here.
Under shooting all week,
The legal limit for operating a vehicle is 100. So everybody comes in between 2.5 and 3 times legal limit. I don't know what he was thinking.
Well, there was a verbal altercation between him and his wife because he played darts with another woman there.
Well, darts are metaphoric for the you-know-what.
Yeah, so that's why she left the establishment and was walking home. I think he chased after her, they had some more words, and then he took off.
What's her name?
Michelle.
Michelle. Same last name? Okay.
Do you know where the family of Lauren Thayer might be?
Should be around the corner.
Right. Nice to meet you. Nice to meet you. He's doing okay. Broke his leg. But he doesn't have any of the injuries that are going to make him be at risk of losing his life. So you don't have to worry about that. But he does have some broken bones. He's got a broken thigh bone on the left. His femur's fractured, and he's going to need an operation for that. He broke his lower back, too. But it's not the kind of fracture that's going to make him paralyzed. He'll be safe from that.
So he is awake. Can I see him?
Sure.
They're going to put a distal femur pin.
It's a shame that it takes something like this to put them back together. They probably could have just sorted this out in the parking lot and none of it would have happened. But I guess you got to be careful with alcohol and darts and motorcycles.
So bad.
had trauma, there's always coffee. They were going right here. This is the first time I'm actually going to this coffee place right now. Being new to Portland myself and new to this hospital. In my life, certain things are very important when I'm working. One is coffee, the other is M&Ms. I want my tall one with all the espresso and all the fat you can put in it. Should I ask for double if I want like extra espresso? Yeah, give me a double large. Small, double skinny. He's a double skinny short. Double skinny thing. You're making me say skinny a lot.
Short skinny latte, double?
See, that's a big coffee. This is a Portland coffee. This is a big, big coffee. When I give this to Dr. Campbell, Jeff's going to look at this and he'll probably have latte envy. Hey, Jeff.
Oh, thank you.
Can I ask you a question?
Yeah.
Do you have latte envy? Because my latte is bigger than your latte?
Whatever.
Yeah.
But no, the answer is no.
You have something that'll sleep them, something that'll paralyze them. You're set for the day. Gary?
My name's Heidi Getz, and I'm an anesthesiologist. I think of all the physicians, anesthesiologists are probably giving you the most drugs of any doctor you're ever going to meet.
I remember when I was learning how to give shots, boy, my hands would shake. And then I realized really quickly, after a couple of times, it doesn't hurt me a bit when I give a shot. So I got very much used to these things.
We're getting a 35-year-old male who's been shot in the face by the police.
36-year-old Robert Schooler was pulled over for reckless driving.
Nobody who shot you here.
He resisted arrest and was shot in the face by a deputy sheriff.
No meds, no past medical.
Can we help you and get some of that blood out of your mouth? Bring it forward.
Oh, yeah.
He's very uncomfortable. I'm going to feel the back of your neck. Is that bothering you, sir? Push up. Ow, man.
Oh.
Where'd that hurt?
My mouth.
Oh, your mouth. Okay. I think his neck's cleared. All right. We're going to let you sit up.
The bullet passed through Robert's upper jaw, but his brain is intact.
Lean back.
Who fucking shot me? It's everything. Shoot somebody in the fucking face.
Look, just try and relax right now, okay? Chill out.
Chill out?
Okay.
You're not shooting the mouth.
Excuse me. What's your name, sir?
Robert Schooler.
Robert, can I look at your eyes, please? Here.
Oh, no, they didn't hurt me. You're
Look at me. Look at me. We're trying to take care of you.
What the are you guys looking at?
Robert.
Get the out of here.
Robert. Get
the out of here.
Robert, listen to me.
I don't care.
Hey, no.
Hey,
Robert.
come on.
Robert, hey. Wait, Robert, we're working on it.
If you don't relax, they're not going to take them off.
Robert. The more you yell and talk, the worse it's going to be for you.
I don't care.
Well,
what is going to be worse for me? I've already shot him.
The question is, will he cooperate with us when he's not restrained? He's a big guy, and patients can hit you, and that's one thing you don't want to happen.
cuffs are just about off here, okay? So just try and relax.
We'd have to have his cooperation, and we either get it by charm or we get it with pharmaceuticals.
All right, Robert.
Sit up front. It's very much like being a Girl Scout. You know, be prepared.
Robert needs surgery to get his face put back together again.
He was shot in the face. That is scary. You know, I mean, it's not like he can cover it up with a shirt, you know?
The subways are running on time.
I like rain. I come from sunny California. I find that very boring.
You know, rain once a week was not nearly enough. I wanted to see if I could experience rain at least 3 or 4 times a day.
You could take all the sun and pack it away. And people hate it when I say that, but, you know, it's good for your complexion, you know, it gives you that nice glow.
My body's never been this wet. Perpetually wet. I think I had moss growing in my underwear.
I just as soon have it rain. I love it. Not a problem. And everybody in my department thinks I'm whacked, so. His mouth was more distorted than I thought. He's lost pretty much all his upper teeth. And at the top of his palate's hanging down into his tongue. We're going to have you go to sleep. When you wake up, your face is going to be fixed, okay? Robert, do me a favor. I'm serious. Just relax, okay? It's going to make it a lot easier for you going to sleep, and it's going to make it better when you wake up, okay?
In anesthesia, anesthesia, you control the patient.
There you go. You might be in there.
We keep you alive while the surgeons are trying to fix you. I'm just watching his vital signs and making sure he keeps oxygenating and keeping him asleep at the same time. Every move he makes, every breath he takes, I watch.
Surgeons close the bullet hole in Robert's face and reattach his upper palate.
At least he got to keep his beard and mustache.
He's going to be kind of confined to his bed for a while, I think, because I think he's under arrest.
How you doing? Doing good. How you doing, Kate? Excellent. Well, not really excellent. I just said excellent. Right. I'm doing okay.
Thanks for your honesty.
Yeah. What is this?
Okay, Rita.
What is this?
Greyhound trainer Rita Fazio got caught in a dogfight.
Multnomah County. Yeah.
Hi, I'm Dr. Baruch.
They've all had their shots and everything. They're at the greyhound races, the dogs out there at the Multnomah County Kennel Club. Okay. She's one of the trainers. Her and her husband, they got knocked down. There was 5 dogs in a fight. The blood is from one of the dogs. One of them got killed. Pulse was about 86. She's had a total of 4 milligrams of morphine, IV.
So what happened, sweetie?
They just got in a fight, and they're big, powerful dogs, and they all picked on one, and I tried to get it away from them, and they knocked me down.
And they knocked you down. They stopped biting you?
No, they didn't bite me. They were just fighting the other dog.
What's your problem? You twisted your ankle, or you fell on your ankle? You fell on your knee. What I'm going to do is I'm going to start off down here and work my way up there, okay? Tell me when you first start having pain, to when you really want to hit me, to when I'm off your Christmas list.
Okay.
Okay? Here, does that hurt?
No.
How about if I'm going to move up your leg?
No, it's starting to.
It's starting to hurt right here. Can you bend this at all? Don't worry about it. That's it. Don't worry. We're gonna get it. We're gonna X-ray this. It looks like it's definitely fractured, dislocated. Okay. If you're in pain, let me know. Okay. Because I definitely have more pain medication than you have pain. It looks twisted. The whole thing is twisted around. All these ligaments have been ripped. Have been just shattered and ripped to shreds. And the whole knee itself is rotated this way. I'm going to call the orthopedist, the bone doctor, the specialist to come in and take a look at you. Okay, because that's going to have to be operated on. Do you know what spurred him on, or?
No, I don't know what started it.
Sore winners, sore losers, taunting. Okay.
Okay. What we're going to do here is give you some medicine to make you sleepy and to help with your pain, and then see if we can't get your knee back where it's supposed to be. Okay?
In Portland, when the sun comes out, the trauma increases.
Are we going to 15 for that one?
We're going to 15.
A car has crashed off the highway. Paramedics arrive with the first of 3 victims.
Here it goes.
I'm so cold. She's in another ambulance. I'm so cold. This is Brittany, 19 years old, unrestrained driver, complaining of pelvis pain and 2 fractured ankles.
Brittany Allen smashed her car into a guardrail. The impact may have damaged her spine.
You're in the hospital. Belly's tender. Pelvis is stable.
My ankles, please do something with my ankles. My ankles hurt and my back, my lower back.
She has deformities on both ankles. I feel a dorsalis pedis on the left, but not on the right. The car was pretty well destroyed. The whole front end is kind of twisted up in a big hole. It looks like an L.
In my back.
How much you been drinking?
Please, somebody rub it or something. It hurts. I've been drinking.
I don't feel comfortable yet.
I need to...
This is the other half of the trauma.
14-year-old Cheryl Smith was in the car with Brittany.
Owie, don't move me. Please don't move. Please don't move me, please.
And your date of birth?
11/21/84.
Okay. Who's driver? Who's passenger?
Brittany was driver, baby was in the middle, and Silver was passenger, and I was back seat.
TM's clear, blood in both areas. Give me a poke in your right groin. I feel it. Open your mouth.
So you're a passenger? Where's the baby?
Where's the baby? Where was she?
Where is the baby?
I don't know.
Is the baby coming in here?
Oh, got my baby. I think my baby.
Your baby.
Oh, my baby's within the car.
You know, you never leave a child unrestrained in the backseat of a car while you're driving drunk.
No, my baby's within the car. Oh, no. He's within the car.
How old is the baby?
2.5.
Is the baby a trauma?
Yes.
No car seat. We found her in the front seat, but we don't know where she started her journey at.
Great. Another unrestrained kid. Yeah. You want to go see Mommy, huh? Well, we'll go see Mommy in just a second.
Come on,
Here we go.
Brittany Allen's daughter, Kaylee, arrives with no major injuries.
Kaylee, honey. Okay.
But Brittany isn't as lucky.
You have broken ankles, Brittany.
Oh, my God, why?
Were you driving?
Yeah.
What happened?
I don't know.
Are we ready?
Laceration?
Head and belly. We're doing head.
You know, I've been here 12 hours. Give me a break.
12 hours? How long have we been here?
I've been here 32 years. How about you?
29. I've been on this earth for 29. Okay, I want to touch your back, Brittany. Tell me what hurts.
Yeah, that hurts. That hurts. That hurts. That hurts. That hurts.
Thoracic and lumbar spine.
My ankles hurt.
Brittany has a fractured back and 2 broken ankles, but no permanent injuries.
She was found in the front seat of the car.
Yeah, I know.
Mom was in the front seat also. The other 2 were already out of the car. But she seems to be doing okay.
He needs a blood. My ankles hurt so bad, you guys. And my
Brittany?
lower back hurts too.
Police officer wants to talk to you.
That's fine. Please just
He's
take
right
the
over there to your right.
Before I draw the blood, is it okay we draw the blood?
Why do you want to take blood for?
Well, just for us to do
See the alcohol?
Yeah.
Okay, that's fine. I drink a lot.
You're subject to criminal penalties if the evidence shows you're under the influence of intoxicants, okay?
Yeah.
Did you understand what he said,
He said
Brittany?
that if I fill my alcohol thing, what now?
Your license could be suspended. Okay.
Hopefully, you know, she doesn't do this again, because next time could be her life.
Yeah, don't drink and drive.
Right ankle, left ankle.
That's a no-no. Because that's what happened, yeah. It's not good.
Here we are in Portland right here. You got Mount Rainier, Mount St. Helens, Mount Adams, Mount Hood. The whole coast is state parks. I just think you got to go outside every chance you get. So we go up on the roof or we walk between buildings outside. So we're trying to figure out some way to get our offices up here. We have a few offices, secretary phone, a nice beach. Maybe a little driving tee. Hit golf balls off into that field out there. I don't know.
Any questions or orders at this time?
This is Emmanuel, no question. We'll see you in a minute.
It's all blunt trauma. We haven't had a penetrating trauma yet. Sounds like a guy who stabbed himself in the chest.
It was a 3-inch long pocket knife that went in the full length 3 times, left chest.
During a standoff with the police, 49-year-old James Smith tried to kill himself.
That's 2 psychiatric patients in a week.
We don't know that reason. That's for you to find out.
James, the 49-year-old male, being brought into custody by the police. He got the beanbag
Okay, let's get him restrained.
into the chest 3 times. He also stabbed himself with a pocket knife. They described it about 3 inches in that area there.
3.
He does drugs and stuff. He's had alcohol today also.
The knife may have punctured James's lung or damaged his heart.
Take a deep breath.
He's got normal breath sounds bilaterally.
Yeah.
I see 2 1 centimeter entrance wounds.
No cramping is felt in the left chest.
His heart rate's regular, belly soft.
All right, before we start doing that, I want to roll him left, I want to roll him right, I want to look for other wounds, please.
Put the band on.
Now,
Right
count
to
of
the
3
band.
from the head. I don't know what drives a guy to pound a pocket knife right through his own sternum, but somehow or another this guy managed to do it.
Look everywhere. Look under
1,
his
2,
arm.
3, 8, 6, 9.
Respiratory rate 16. What's this blood from? Lift his leg. Look down there, please. Can you roll the other way? Can we get X-ray in here, please? Need it. Nothing on this side. Hold on.
Paramedic, you're gonna feel soaked here.
We're ready for X-ray. X-ray. Big inspiration there. Got a bad one. Good, got it.
The police were called. They came, asked him to come on out. He wouldn't, and then he began this lethal stuff himself. They shot him with a bean bag.
Looks okay. Yeah. So he does not have a pneumothorax on the X-ray, and he doesn't have any signs of blood in his chest.
The knife missed James's lung.
He was in the back.
But doctors need a CT scan to see how deep the wound is.
I wanted to ask you, Baruch, doesn't that mean lightning?
No, it means blessed.
It also means lightning.
It also means the cows are dying in Texas.
Alors.
The most complicated things about going from hospital to hospital is trying to find out how the chairs work.
Contractor Mark Hooten cut his hand on a piece of sheet metal.
We have a around 6 to 7 centimeter laceration across his hand. There's no sensory or motor deficits, and essentially I think it was just a really impressive way to extend his lunch hour beyond the normal. He's going for some serious pity points, but we'll just close this up
And prescribe chicken.
and send him back on his way and tell him not to play the piano for at least 48 hours. I was brought up in a family, and I was brought up with friends who, this is what you did. You know, you either had to joke around or you didn't survive. This is a little more than you bargained for when you came in here today?
Yeah.
I'll tell you something, it's more than I bargained for when I came in today. I think patients enjoy that. You know, you have to care enough about them to make a joke. Terrific. Tommy's going to come in. We're going to clean you up. We will send you back to work with no use, no grip of your left hand. And that's it.
Okay, thanks, man.
All right.
I appreciate your work.
No problem.
He was being apprehended on a restraining order by Portland Police Department. They shot him 3 times with a beanbag. And then he stabbed himself 3 times.
Head and abdomen, Art.
The CT shows that James's stab wound is in a dangerous place.
So he's got fluid around his heart as well?
Yeah.
James may be bleeding from his heart. He needs exploratory surgery.
Let me ask you a couple of questions. What are the choices?
Do a mini lap up epigastric, go through the diaphragm, and do a little window and see what happens.
That's exactly what I want to do. Let's just go do that.
Okay. We're surgeons, so we like to operate. It turned out to be a more significant injury than just 3 little cuts in the front of his chest. And a long pickup. Some long analysis, please. We had to hit the lining to his heart and look at the heart itself.
He got himself a little hole about that big in the outflow tract on his right side of his heart. He's very lucky. But he should be okay. He's not even bleeding that much now. You get it first, a little tip, yeah. Just the tip to bend it over, because that'll stick in. And I usually don't put it in the crack. I put it off to the side.
With 3 stitches in his heart, James's surgery is a success.
Dr. Lamb was amazing.
Okay, getting ready. See, I told you I wanted a case that...
You can actually do, okay.
A little hole. Wasn't bleeding much. He's a pretty lucky guy.
11-year-old David Elliott was playing in the surf on the Oregon coast. A large wave dropped a 2-ton log on his chest.
Steve, I'm just going to grab some ketamine just in case.
That kind of work by
Okay, railings?
No.
Switch with you, go around.
Take this. There you go. His heart rate, that's why I wanted to consult with you. He's tachycardic. He's gone up about 20 points in flight. And he developed
The log crushed David's chest. He could be bleeding inside.
Ready?
Tell me when you're ready. Go! So you saw pulmonary contusion on that side, and they think fracture ribs, but they can't see him on X-ray. He is tough.
tough to ventilate, kids. This is hard, Steve.
43 on the way in.
It's terrible pressure.
Get ready to do a chest tube just in case.
As an anesthesiologist, Dr. Getz is in charge of David's vital signs.
His pupils react real well.
Films, Dr. Gatner?
We're going to get a chest.
These are the films from Tillman.
What size tube you got in here? It looks like a teeny weeny.
I don't know.
David's not getting enough oxygen. He needs a larger breathing tube.
I need some more suction.
When a patient comes in and they're having trouble breathing, you have a way to stabilize that situation through your ability to get their airway, and it's expected of you.
When you feel me pulling, you should push.
Tube. Thank you.
Boy, I'm good at this.
Okay, now we got airway. Now we're talking.
With the tube in place, David can breathe. But Dr. Getz is worried about internal bleeding.
He's got blood on his left, so he's bleeding in his left lung. Don't know what's going on in his stomach. He was out a long time.
Okay, we go to CAT scan.
Perfect.
With kids, they kind of got to prove to me that they're okay before I feel comfortable.
You gonna stay with him?
Well, I'll get him in and then I'll come and see what's up.
This job is no different than any other job. You know, you gotta go in, you gotta have fun. I like the people around me when I'm working here. I mean, it's a fun place to work. Okay, I got it. I'm sorry?
Give us the old see it, Doc. Yeah.
I'm going to give you the Carol Burnett. You know, right now I have no inclination to leave immediately. I mean, I said I would give it at least a year. So
Good night.
You know, it's good, if anything, just to cleanse my palate, so to speak.
Oh, okay, that would be.
When are you going to leave me?
I think I want to do academic medicine, so be a teacher and be a doctor at the same time. Being a teacher or a doctor, I think, matters in the whole scheme of things.
Hey, put the makeup on now first.
That's right.
I gotta put the makeup on.
You're the man. How you feeling?
Stab wound victim James Smith is recovering from surgery.
How does this feel here?
Not too bad. A little sore up, but when you do like...
Yeah.
Yeah, right there. Right there.
It's kind of funny, you know, for a while there you really needed a social worker and a psychiatrist.
Yeah.
Didn't get them, so then you really needed a surgeon.
Yeah.
Got that. And now you're back at the phase where you might need a social worker and a psychiatrist again for a little bit. What do you think?
I don't think I need a psychiatrist. I can talk to one, you know, no problem talking to one.
We always wonder when somebody comes in having hurt themselves, what right we really have trying to fix them up, but I figured you were pretty uptight and pretty upset.
Oh, beyond uptight. I mean, everything just started collapsing on me. Friends, even my kids, daughter turned against me. You know, what can a man do? I crossed that line.
I think you got kind of inside that radius.
Yeah, working across that line there.
Crossed a couple of lines.
I was all right until the officer came in with the bean gun. That really changed my mind about it.
So you got to tell me, does it hurt to get shot with a beanbag?
No, really it didn't. I guess I was so uptight, so I really didn't bother me, beanbag. I felt the bruise, it hit me, but it didn't really do like it's supposed to do, knock you down. I was like, that's you got? And I guess that ticked him off, you know.
Yeah, he hit you a couple of times. All right, we'll catch up with you tomorrow.
Anybody go through this, think twice, maybe 4 times. Okay. All right, thanks a lot, Dad.
We'll see you later.
I go swimming in the beach in L.A. I don't expect to get hit by a log, but I guess you can do that here because there are big logs.
We're definitely not doing it.
Let's do it slowly. 1, 2, 3, over. Looks like the lung tissue itself is injured. See this side?
Yeah.
Air's in there. It's nice and black here.
Yeah.
It's all contused. This is not good. It's usually your lungs are protected from bruises because you have ribs and fur and all that other stuff, but he got whacked.
Oh, hello, hello.
What is
The liver. He's got a liver laceration, which may one of the reasons why his heart rate's went up a little bit.
Fluid status.
David's parents arrive.
Concerned about that because he has this laceration of his liver, so that's a site of bleeding, and he has a pulmonary contusion, and he's bleeding there too. But I think all that stuff is going to stabilize, and then he'll just get better on his own. And that's what I think is going to happen. That's how he's been behaving. He's been very, very stable for us through this whole thing. So he looks perfect. To me, he looks perfect. To you, he may look a little funny, but to me, he looks really, really, really good. Okay? Nice to meet you. Tell me. Nice to meet you. Heidi gets. Like whatever she wants, she gets. Nice to meet you, too.
David's injuries will heal without surgery, but he can't leave the hospital for at least a week.
It's always something different. You never really know what's coming through the door. And it's almost like, can you top this, you know? Everything we did turned up on the 11 o'clock news.
Just in terms, your mom said that you're going to turn 12, I guess, in here in the hospital. Do you have any wishes for that 12th birthday?
Oh, that I can stay alive.
You'll stay alive.
I don't mind being known as the drug lady. You know, I only use my powers for good, so it's okay. Okay.
I just know when I came in I was real obnoxious, and I guess the people that are trying to help me, they're not the ones that you should be mean to.
People say, geez, you're a cool guy, I'd like you to be my doctor. No, you don't. I mean, you don't want what I do. It's people who need what I do. I feel really good about being able to do that for them.
So what's up?
Got the ABG, we're calling AJ, they're not quite ready for it yet. I haven't called them yet, I was about to do that right now.
How many are we getting? 3?
5 that I know of.
Oh, wow. And it's a 24-hour thing, and, you know, hopefully eventually when I'm done with residency, I know pretty much how to take care of everything. Hey, maybe we'll get another heart case out of it.
You are so greedy. It's like
Would you rather get a happy hour or get a heart case?
Oh, probably a heart case.
This is a level 2 that's going to 15.
Level 2, second one in this accident.
Okay, let's get ready.
It's real people in real life and death situations. It's the most critical cases from TLC's hit series Trauma. Life in the ER. Call now to get Most Critical Cases on home video for just $19.95 and see the series' most gripping and emotional real-life drama.
We have no X-ray in the room. We need X-ray call staff.
Now, you can't get any closer to a real ER.